The Food and Drug Administration just approved a treatment for sickle cell disease. Sickle cell disease is a red blood cell disorder that affects 100,000 Americans, many of whom are black. Red blood cells become misshapen and die early. So this new treatment is the first in the U.S. to use a gene editing tool. Dr. Jeff Potthoff from UW Health joins us now to talk about this and so much more. Dr. Potthoff, good to see you. Happy Monday. Before we get to this new treatment from the FDA, can you explain a little bit more about what sickle cell disease is and what the normal treatments have been?
Right. So sickle cell disease is a disorder of your red blood cells. So your cells that carry oxygen, where they take kind of a sickled or curved shape. This unfortunately makes them a bit sticky and they get stuck in things like bones and blood vessels and they cause a lot of pain. To date, treatment can be oxygen. It's usually pain medications, trying to avoid the things that make those cells sickle. But this new treatment aims to end all of that by curing sickle cell disease in those who are affected.
Yeah, and so it does that by using this gene editing tool called CRISPR. The inventors of that tool actually won a Nobel Prize in 2020, so this is fairly new. What can you tell us about CRISPR?
Yeah, I mean, this was something that would be science fiction just 10, 20 years ago. But basically, you take cells from the person, so red blood cells, stem cells, and you use this CRISPR tool, which basically cuts out the DNA sequence that tells the cell to sickle, replaces it with the good sequence that says don't sickle. You kind of depress the systems or the patient's immune system. You put those cells back in the patient, and then all of their cells that make red blood cells don't sickle anymore. You can essentially cure it. It's a small study group that did this. 30 people were followed for 18 months, but 29 of the 30 were cured of their sickle cell disease.
Some pretty stunning results there. For folks, though, who are a little apprehensive about gene editing, what would you say to them about this new treatment?
Yeah, I think that's fair. This is a brand new treatment. It's a small study. I think we do need to do more studies around safety. I think likewise for this treatment, although it sounds science fiction, its price tag is exorbitant. $2.2 million for the therapy, plus up to 2 months in the hospital and those associated costs. This treatment for the time being will be out of reach for most people.
Yeah, at the top of this interview, you said that this sickle cell disease affects about 100,000 people, many of whom are black and brown. How do people know? What are some symptoms of sickle cell disease? Because I feel like a lot of people have it and they don't realize that.
Yeah, quite frankly, sickle cell disease is diagnosed at a pretty early age. And a lot of it is found by people having a lot of pain in their joints, pain when they exert themselves. It's pretty easy to diagnose. Once someone takes a blood sample, you'll see those sickled cells there. So not difficult to diagnose. Most people who have it will be diagnosed at an early age.
Okay, and really quickly before we let you go, I want to talk about the applesauce recall. The FDA recalling some applesauce pouches for high levels of lead.
Absolutely. This is a good reminder to families. There's these 3 brands. You can see them on your screen. There's cinnamon applesauce, and the concern is that the cinnamon that came from Ecuador likely contains lead. So you want to get rid of these if you happen to have them. Things you would look for oftentimes in your children, affects younger or smaller people, would be things like gastrointestinal symptoms, nausea, vomiting, diarrhea, musculoskeletal pain, so muscle aches, and then things like headaches would be some of the common symptoms of acute lead toxicity.
All right, Dr. Jeff Potthoff from UW Health, always great to have your insight on a Monday morning with us. Thank you, appreciate it.